I'm Sophia. I'm one of the women's health physios here at Physio in Arundel Heights. And I thought I would talk a little bit about why people come and see us here for women's health physiotherapy. It's becoming quite a buzz term at the moment, women's health physio, but a lot of people don't know what we actually do. So I'm going to talk through a few little things about we actually manage and treat here. So if you are experiencing any of these symptoms, then give us a call or book online. I'm more than happy to talk about them with you. So one of the things is stress urinary incontinence. So that is when you're leaking urine, when you laugh, cough, sneeze, jump, lift, anything that's increasing that pressure in your tummy and you're having that little bit of leakage that comes away. And it's one of the most common things that women think that I've had a baby, so I'm gonna leak, and it's not necessarily the case. So I would definitely suggest if that's happening to you to get that checked, because that doesn't need to be your life. One of the other things that we see is women who are experiencing urgency with needing to pass urine, and when they're getting that urgency, it could be that they're having a trigger. So whether it's getting the keys in the door or whether they can hear running water, they're getting that real sense of urgency, and some women actually have some urinary leakage as well associated with that urge. The other thing we assess for here and manage is pelvic organ prolapse. So that is where the vaginal walls have some movement. 75% of women will have some degree of prolapse at some stage in their life. And we can assess whether you are in that population and the kind of things we need to do to help you manage that. One of the other things that people, I guess, don't realise that we can also treat is people that are having pain during intercourse. Might be that their pelvic floor is actually really, really tight and high tone, and we can assess that and actually do some manual therapy and work with you with down training your nervous system and just look at really helping you make being intimate a lot more comfortable for you and your partner. Pregnancy, so we deal with pelvic girdle pain in pregnancy, any other musculoskeletal injuries that you might have, or any pelvic floor issues in pregnancy like leaking urine. And also postnatal, we're getting a lot more women coming through asking for a postnatal or pelvic floor check after they've had their baby. I think this is fantastic. The word is getting out there. I feel that all women should have one after they've had a baby, whether that's vaginally or via C-section. We're checking the function of the pelvic floor. We also assess for prolapse. We can help guide women back into exercise safely, and look at planning for them getting back to their normal life, really. So those are some of the things that we treat here in clinic. I've probably forgotten some of the things, but we are here to help. And if you have any questions and you're not sure, please give us a call at clinic or book online, and we're more than happy to see you.